It is my pleasure to be here today after a pretty long time. The last time I was here, it was in Symbiosis, was in SYMHEALTH 2019, with an opportunity to share our insights, what we've been working across the 40 countries in the healthcare system. Today, I take this opportunity to reflect on one of the interesting topic, which is the partnerships in the healthcare system. Partnership has been one of the top agendas in the healthcare system across the globe. And with KPMG, having worked in the 40 countries with a network of KPMG Global, we reflect on some of the innovative partnerships that have fostered in the last few decades. Especially post-COVID, there are some interesting and innovative partnerships that we have reflected, contributed, and taking to the various countries so that we can implement in improving the healthcare system. Today, I have an opportunity to share with you an insight, our point of view, on a very interesting topic, which is about, okay, can you just check the slides? Okay. Well, when you look at the partnerships in the healthcare system, since I started working in the healthcare consulting services way back in 2002, the first projects that we did was in the public-private partnerships. And since then, every year we've been working on public-private partnerships, various models of partnerships, and even today, this is one of the top agenda for all the healthcare stakeholders, whether it is the policymakers, public health experts, and also the providers. In fact, now, post-COVID, even the patients have started talking about the partnerships, which will be very important, which will help them to deliver the care and also manage their health, overall health, with delivering a better outcomes. It's a very interesting to see that how the partnerships can drive the care system in this country. Looking at the forging, scaling, and assessment of healthcare outcomes in the collaborative environment, if you look at the partnership models, partnerships has been there since the centuries in the care system. This is one thing that has brought the care system providers, healthcare providers, the entire value chain together in the various formats. If you reflect back, in the last decade, we saw a lot of public-private partnership projects in India, but post-COVID, if you look at, we also witnessed some of the innovative models that we can reflect on and that we can carry forward to build upon. Historically, if you look at the public-private partnerships or any form of the partnerships, the crux of the partnerships are basically the business-driven objectives, either to have a profit or to drive the larger initiatives of extending the services or providing the access to the care, or two companies or various providers coming together to provide the service delivery gap. But what is very important that is missing in the partnerships is that the patient is completely missing out in this partnership devices. When you devise a partnership models, the patient's outcome and the overall patient management is not reflected as a part of larger partnerships that you should see. If you also look at the care system that we have in India or some of the countries, the patient is not very much involved in the overall care delivery and the care system. However, the patient is an important part of the health system and the entire care pathway. But when you look back, the patient is least involved in the overall care management and the health system. And I'll talk about that, why are we saying this, and what is the challenges that we face, especially in some of the developing countries, including India. The reason for the limitation in the involvement of patients in the care pathway and the care system is primarily twofold. There is a limited care understanding about the health conditions, and so patients' knowledge is very limited when it comes to it, because the doctor speaks in technical jargons, medical jargons. You don't have that much time with the providers so that they can spend the time with the patients to make them understand, create that awareness, whether in the patients or with their families so that they can be part of the care system. Secondly, also there is a challenge in terms of understanding and reflecting on the hierarchy that exists in the care system. So a patient who has limited knowledge, does not have an access to the right kind of an information, neither they are educated at least stage of it, so that when they come to the care settings, providers, the care providers are the utmost top of the hierarchy, and so understand that whatever the doctors is saying, the providers are saying is the right thing for them to reflect and understand and not question the basic implementation of this. And hence the patient plays a very important role of being silent in this entire care system. And lately what we have seen is also the culture norms define that they are afraid to question the doctor's authority, providers, and they continue to go with what doctors say in terms of they consider as the topmost hierarchy of the care system. But increasingly, the patient is becoming part of the care pathways that we see in the developed countries, but also is getting reflected in the countries like India. The patients are encouraged actually to be part of the care systems, and we'll talk about that, how it is happening in some of the care settings, how those partnerships are getting designed, and how it's going to drive the future partnerships in the healthcare system. If the patient is involved in the entire care pathway and the partnerships, there is a shared decision making. The patient is very much involved. For example, when the surgery has to be conducted, where has to be conducted, and what are the backgrounds on which the patient need to work post the surgery, the entire care pathway, how the family would be involved in the entire care settings, the economical background of a patient. So without knowing economical condition of a patient, the hospital will definitely define what is the required procedure or surgery, but without looking at that what is the financial condition of a patient and how it should be taken care. If the patient cannot be treated in a high-end hospital, is there a way that he can be treated in some other settings? Can it be there that there is a provision can be made of financing it? In this entire thing, the patient has to make their own entire decisions. But in going forward, we will have a shared decision making that will help them to be part of the care pathway and the planning. Also, the patient education is increasing. If you see the post-COVID, the entire symptoms that you could see, that you have a COVID, the tests you should be conducting, the treatment that you should be taking at home, the precautions that you need to follow, the conditions that can create an adverse situation and where you can reach out to the doctors, the monitoring of your health, and so on. Everything was because there was a patient education happening during COVID time. Today, we all know if there are symptoms and 2-3 days, if things are not changing, it might be probably as COVID symptoms and we go and test ourselves. Now, imagine this situation happening in other conditions as well. So did happen all of this because there was a patient education that was created by providers, policymakers, and various stakeholders, where patient became a very important part of decision making as well as the education played an important role. Also, what happened is the patient feedbacks become very important in redesigning your care systems. A continuous care setting improvement requires a patient feedback taken frequently, and you reflect back, and the policymakers, providers, the care setting operators do something which will help them to provide a better care to other patients. And very important, when the patient is coming entire care setting, for example, if it is detected at the OPD level and diagnostics has to be done, the patient is made to run from one place to another for a diagnostic services, getting the medicine, then arranging the beds in the tertiary care hospitals, finding its own way to find the right hospital, what kind of a doctor he should go for, what kind of a financial or the benefits that are available under which he can avail and get treatment. All of those things, the patient is actually coordinating its own care. Imagine in the same setting in the other aspect, if you have to go to Make My Trip or some of the other traveling with, you book your travel, they will arrange everything for you, correct? Your tickets get booked, your services are there, you have your car organized, you just need to pay for entire packages. And it's not only a package for your hotel or the transportation. They will ensure that you get your right check-in there, any issue is there that you get arranged. They manage their entire trip for you. Why that cannot happen in a healthcare setting? Why don't we have a care coordination providers here? Reflect back on this. The same room that I'm looking at right now will be part of some of the interesting models that will get designed in the coming times is a care coordinations. This kind of a models are very prevalent in US and other model. It's called as healthcare management or healthcare management service operators, or you can call them HMOs, health management organizations. They take an ownership of managing the health of a family and an individual. So they take care of health in a totality. So they take care of individual's health, keeping you safe, health and wellness is managed. In case you have to avail the medical services, they will coordinate your care. They have the network of the providers. All of that thing is going to happen in India as well. Well, there are various reasons, as I reflected earlier, why this entire thing is not happening, especially in India. I'm sorry. Okay. Sorry. The COVID-19 is a classic example that how the crisis led to a total transformation of the care system that happened. We could never think that a patient in India will be willing to do a self-care. We were managing ourselves, we were managing our family, we were monitoring our symptoms and so on. We had a care setting being set up in the household. We had a care setting set up in our community, in our buildings. We had the community supporting the individual in the overall management of it. Whether you should come out of the house, whether you should require any services, whether you need any of the services, arrangement of the medical services. The government was monitoring your entire care at home. So I remember when I got a COVID in Delhi, I was in a hotel for almost 21 days. And Delhi government people used to call me twice in a day, checking on me whether I'm monitoring my parameters, whether I'm keeping well, everything used to be noted. Imagine that thing happening on an everyday basis, or a monthly basis, or on a periodic basis. All of that can happen. I think it was in a prototype and a proof of concept that this kind of emerging care model can happen in India, and the care system will get changed in the coming times. You had hospitals and providers. When you would get someone notified into a COVID positive, the information used to go to Ministry of Health, to your state health department, to your local health officers. You used to get triggered from your hospitals. You used to get an ambulance at your place. Somebody used to come and arrange for it. All of that was a care coordination that could happen. Imagine what you're looking at is on the top that you see is the traditional healthcare value chain. This is how, in simple, the care pathway used to be there prior to the COVID. Although the different disruptions, innovations, and interventions were in pipeline, some of them got reflected. But very important part is that the change that happened after the COVID was at a significant pace. What was something going to happen in the next 5 to 10 years, started happening in 1 to 2 years itself. You can see the number of digital health providers, the care coordinators, the healthcare data analytics and the digital health providers, the entire concierge service in healthcare, and a lot of innovations that has come into them, which has actually complicated and increased the entire ecosystem of the care system here. You can look at it, that a patient has various options of health and wellness apps, smart wearables, IoT devices at home. You have wearables today where you monitor your health. You get your ECGs on your wearables today. You have an IoT devices where your weighing machine can detect your weight, your BP machine, and all of them are connected to a mobile phone. The data can be sent to your home care provider or any of your doctors. He can monitor, and in case there is any emergency, your wearables can reflect back on this and send you an emergency services. Imagine the care setting is changing every day. What you're looking at is the care system is expanding in all directions, which reflects is that in entire setting, it's only going to get the complication for a patient to navigate and avail the healthcare services. What does it call for then? Its only way is that you have a partnerships and collaboration in this entire care setting. You will see more of complementing partnerships than the competing environment here. The healthcare provider will stop competing with each other and will have a complementing collaborations. And unless they do that, it will be very difficult for any providers in coming time to continue to provide their services. So for example, if you believe diagnostic services in your local setting will continue to operate in coming time in next 5 years, 10 years, seriously it won't happen, because the patient journey towards the diagnostic services or availing the diagnostic care will not only depend on your local general practitioners, but it will have a lot of other elements that is going to determine the care pathway and the decision making. It's very fluid today. The patient goes to online consultation, the second opinion, you have your Googles, you have the chat GPT 4.0 plus plus coming in times to reflect and guide them on what kind of diagnosis services today. There are providers who are going to negotiate the rates with the different providers to navigate and take you to the preferred networks. All of this is going to change in the coming time. Well, not only the care pathway is changing, but the entire value chain of the entire stakeholders who provide the healthcare services are changing as well. If you look at it, today the suppliers, medical device, pharma manufacturers, supply chain logistics, providers, payer, patient, medical device, all of this is very traditionally arranged. All of them are going to disrupt. Today you can look at and see that medical devices and pharma companies are engaging with your patients directly. Here are examples that I'll share in the slides. Pharma and medical devices are engaging with patients directly in the disease management and various other services. So pharma companies and medical devices are no more focusing on continuing to be one of the player in that entire value chain. The pharma companies doesn't see their value of being a production of drugs and medical supplies. They see to be a part of it, a care delivery. They want to be part of the patient health management, disease management, and overall population health management. And there is a reason for it, because if you do not act and participate in the patient care and overall population health management, you might have a very little role to play in this entire emerging new care system design. Well, there's an interesting models that you can read about, but some of the things that I like most is health management organizations and also accountable care organizations. What it means is somebody is taking care to manage your health. The way you have bank, where you have wealth managers for your, managing your wealth, you will have health care accountable, organizations managing your things. So imagine you are here and your family is somewhere else in other city. Who manages the health of those, your loved ones? Nobody. They have to reflect back, search on the Google for arranging ambulance, diagnosis services, which is a doctor. You will have the accountable care organization managing the overall health of your family, of your community, maybe an entire organizations to an extent. So your entire management. So some of those models that you can reflect. But there is an innovative partnership that has been driven overall on the two objectives, health outcomes and the value instead of volume. How are you going to deliver the value in terms of keeping the patient away from the hospitals or falling sick? The future healthcare outcomes are not going to be that how many average length of stay you had, or what is the cost of delivery and so on. But it's reflecting on how are you able to keep patient away from the hospital. That's going to be a challenge. And the COVID was an example where we could never build the number of hospitals at the speed at which the infection was spreading. We could only do is keep the patient away from the hospital by keeping them healthy, isolated, and ensuring that they are away from falling sick. Well, there are also key levers which are driving this. We never had this opportunity and those levers earlier, and that is the reason some of the public-private partnerships, the innovations, the interventions that we are thinking about, were not able to change the healthcare system to an extent what we can see now. There is an increased use of technology. I've been in the COVID war room for last 36 months now. We were some of the people who started working in the COVID war room. The first thing that we noticed was the digital health and data being utilized in the COVID response management. It was the first time that I could see the policymaker believing in the digital health and the data analysis, because the data and the digital health was the only opportunity for us to respond to a pandemic management, because no other infrastructure could help us to do that. So imagine after that, there has been a greater awareness, adoption, and acceptance of the digital health and the data driven in the entire value chain. So is with the patients. Telemedicine has been there for last 2 decades and more. But you can imagine today, if you have to do an online consultation, the acceptance is very high. And that is all because there is something that we saw that these things can work. Even during COVID time, we were able to manage the crisis, and that is the reason. Focus on population health. It's not going to be overall that how you provide your services in hospitals, how well you run your diagnostic services, how well you provide your insurance services, and so on. It's going to be the population health. It is individual family health management, individual health management, your community health management, and overall management of the population is going to be a very important aspect. You have very interesting models in Israel and US, UK, where health management organizations provide the entire population health management to a community or to entire district. There is emphasis on the patient-centered care. There is increasing awareness and the acceptance that patients should be made part of the care design. Greater involvement of payers and regulators. You can see Ayushman Bharat National Health Authority is getting actively involved in what are you delivering, what is the prices, what kind of a medical supplies, equipment that you are using, the doctors that you have, infrastructure that you have. They're also working on the value-based care. Insurance companies are now working with various providers that how a care outcome should be one of the focus area for the delivery. There is also an emphasis on the transparency and accountability. What we took from the COVID and the partnership that we saw during the COVID time, there was a very important learning which we were missing from last 2 decades, I would say. There was a trust and the transparency was missing in the care setting. No provider, no policymaker, and patients would trust each other, and neither there was a transparency between them. The hospital will not tell you what will be the total charge of the providing a surgical procedure till the procedure last bill is generated. Policymaker never had a faith in the providers that whatever charges that they were paying or whatever services that we'll outsource to them, they will be ensuring that there is a overbilling or there are certain practices which are not accepted to them. And the patient never believed that whatever they were doing on the care setting was reasonable and required. When they went to a doctor, he would ask you for 1,000 rupees. He would say, why would you charge 1,000 rupees for a care? They would go to a cinema and they would spend 1,000 rupees. That's okay. So imagine there is a lack of trust and transparency that was limiting the partnerships and collaboration in the healthcare settings. This is going to be the fundamental of the partnerships and the collaborations in the coming time. If the healthcare setting has to change, the trust and the transparency has to be brought in, and it has to be brought in across all levels. Well, there is the interesting stuff happening. What we used to see is public-private partnerships where private sector would work with the public sector in delivering some of the healthcare care, like diagnostic services, hospital, and so on. But what you will see is a cross-functional, multiple stakeholders coming together in the care system. One of the classic examples is the technology player and the healthcare providers working together. You are all aware about the Apple, Amazon, Google coming together and working in the healthcare settings. Apple not only works in the data that they collect from your phone and the wearables, but they're also working with Johns Hopkins and various other institutes to work on the research data and some of the disease-specific interventions that Apple can work on. Pharmaceutical and technology companies, there are many pharmaceutical companies that we work with, are actively engaging with the technology companies, data-driven companies, analytics, disease management applications, and so on, being closer to the patient, helping them to monitor and use their medicine better, get the entire care setting delivered in a better way. The healthcare and retail. Amazon is a classic example. Walmart is a classic example where they are fostering their interventions into healthcare settings. They are partnering with the providers. The care system is changing. You can see a lot of Walmarts having the healthcare services and the services being offered by Amazon Clinic in some of the retail sites and so on. Healthcare and insurance providers. A lot of insurance companies are working with the providers to design the care system, the packages, and overall management of the care. So in fact, insurance companies are working with the healthcare providers to help the patient from falling sick, preventing them from falling sick and helping them to manage the care better and reduce the cost. Non-healthcare providers are working with the healthcare. You can see a lot of telecommunication companies like Jio, Telenor in Bangladesh, and a lot of other companies working in the healthcare sector with the providers. So for example, if you want to look at, in Bangladesh, there is a telecommunications company called as Telenor, which works and have an application called as Tonic. The Tonic is a teleconsultation based on AI, which does a triaging and a free services to all the telecom subscribers. So they can get a 24/7 value-added service of having a doctor consultation free of charge. And they can avail different discounting services, have their care getting coordinated, and so on and so on. There's also insurance that a Telenor company provides to a patient and to their subscribers. Imagine this kind of a things that is happening. It is not only the healthcare providers, but also the non-healthcare providers that are intervening into healthcare settings. Now, some of these examples we have spoken about, Apple, Walmart. There's an interesting setting. You can look at Uber and Lyft. In US, even in fact, Uber and Ola during the COVID time entered into a MOU with the government to ensure that the healthcare workforce was commuted from one place to another with the help of Ola and Uber fleet. And so is happening in the Lyft. So Lyft is a cab service in US which provides services of patient pickup and drop for the hospital providers in the ambulatory care and the hospitals. Well, we also see the medical devices companies getting closer to the patients. The medical devices is very close to patient. It collects the data, the most of the data in the home settings on a very frequent basis. So imagine you have a blood pressure machine, a weighing machine, or any of the medical equipment at your homes. The data, amount of data it gets generated and the longevity of the data that is generated is significant for medical devices. And that is one reason why medical devices are increasingly thinking about having an IoT, having a connected devices, engaging with the patients in the better care management. So the data from your, the medical equipment that you have at home can help the medical device companies to monitor your care path, ensure that they can work with the care providers in delivering the better cares, and so on. There are various examples that you can reflect back. You have J&J working with Carcinos Healthcare, digital surgery being planned by J&J and other various partners. These are some of the examples that you can look at an example, but there are immense number of things. Especially after COVID, medical devices company has become very active in the patient care management and the disease management. Well, so is the pharma companies. The pharma companies are no longer into production and the delivery of the drugs. They are not only into the research, but the data that they require and keep improving their drug delivery, the therapy, and so on is reflected on the data that they deliver and the care settings that they have at the home or at a provider level. So pharma companies are working closely with the hospitals, patients, the general practitioners in the overall health management. So the data that they collect helps them to understand the efficacy of their medicines, efficacy of their, the therapy that they have, and improve the entire designing of the therapy, the drugs, and so on. So they understand that earlier they used to buy this data, from the data companies and so on. But now they're getting very closer. They're using this very interesting models where they have their applications. So we have worked on with one of the pharma companies to do a disease management for one of the districts in Telangana, where the entire intervention was to help the government understand what is the level of diabetes and how can they help in reducing the diabetes or help them in channelizing the patient care management better. So they're working with the provider, policymakers, very closely in the entire care pathway. Well, all of this is going to focus on 5 points, I would say. Advocating for the patient-centered care. That's the entire thing that is driving these partnerships. Providing education and resources. Pharma, medical devices, and a lot of companies are focusing on providing education, not only to the hospital providers, doctors and nurses, but also to the patients. So I've seen a lot of pharma companies undertaking the patient education and so on. There is also encouraging transparency and accountability. So pharma and when medical companies or digital health company works with the patient and entire care delivery, there is also a confidence and engagement that happens, and that builds the trust between the patients, providers, and also the stakeholders, which is increasingly helping them to be active part of the entire care settings. There is also driving research and innovations. The innovation and the research that is happening at a pace requires a continuous data, engagement of the patient, and understanding the patient needs and the change of the disease pattern that is happening there. You can no more be in your research and R&D and continue manufacturing the drugs unless you are with the patient or you understand the disease profile on the ground. And definitely there is a larger acceptance of collaborating across the stakeholders. Well, last model to talk about community hyperlocal models of partnerships. We haven't seen that in India yet, but these are some of the interesting models. I'm sure some of the youngsters who are sitting here, as you start your career, you will reflect on this at some point of your time. Community hyperlocal model of partnership is all about where community is engaged in the care setting management. Today, we have a healthcare management being designed by policymakers or a hospital provider, but it does not reflect what is the requirement of a community, what is the need of the community, what do they need, how they want their services to be delivered, at where they want to be delivered. So this is going to change. The community hyperlocal models increases the participation of the individual and community in overall health management. So community decides what kind of a care they want, what kind of resources they want, how they want their care to be delivered, how often it to be delivered, and so on. So it's a community-driven, on-demand healthcare service design that happens. Well, there are various examples. For example, US, the CDC Places program, which is overall health data that provided to the community, and let the community or the local health department decide what kind of a care design they want to do and how it should be managed. Where all of this is targeted towards a single objective, is the patient care and the better outcomes. All of these things that you see, if everything get coordinated or effectively managed, there can be a better outcomes of a care and a better population health management. It's not going to happen overnight. It's not going to happen in a single interventions. It's not going to happen through one provider or any one stakeholder, but all of them coming together. It will take some time, but it will happen. Well, these partnerships are enabled by digital health and patient-centric approach. You will see the new entrant of care providers in the health system. More players will take a very closer management of a care at a patient level. This is going to be the fundamental of our partnerships in going forward. Multiple value chain will emerge. Today, you don't have a patient starting its journey, going to the GP, nursing home, hospital provider, home care, and so on. There are multiple value chain. You will see pharma companies directly interacting with your patient, medical devices directly interacting with your providers or the patient, and so on. So there are multiple value chain that will emerge of the care setting requirement based on the patients and the care plan that is designed. And definitely, it's going to be very important in connecting directly all the patients and consumer. Patient is increasingly going to change into a consumer, and so is the policymakers and the other providers. Having said that, I look forward that you all become a part of this innovative and emerging partnerships and collaboration in the healthcare system. Having said that, thank you very much for your time. It was a pleasure being with you all.
That was indeed an amazingly informative session. We are grateful to you, sir, for enlightening us and providing us with an infinite wealth of useful information. We are extremely humbled by your presence. On behalf of everyone here today, we thank you for taking out your valuable time and addressing our delegates. Now, I would like to request, before the felicitation, are there any questions? The floor is open for questions. If anyone has, we can take 1 or 2 questions. Okay, the man there.
Hi, sir. Thank you for this very informative session. My one question is about, sir, about the future of palliative and rehab care, kind of a geriatric setup. How is the future for those kind of setup in India, sir? How you look for it? Thank you.
So you would have seen recently India surpassed the population, the highest population in the world. We have the next few decades where we will have the young population with us, but it also provides an opportunity for us to start preparing for some of the challenging decades that we will have, where we will have a large number of the aged population with us. You can see what is happening in Japan. India should start preparing for it, and there is definitely, the change in the entire socio-economic conditions, the way we have nucleus families, the long-term care, the geriatric care, the home care, all of these settings will be required to manage this large population that we will have. Not immediately. We can see some of the models emerging here. There are still some models and the institutions who provide these services. But in coming decades, there will be definitely a great opportunity for this to start preparing for it, and we'll need those things. So I see a lot of opportunity in this space, and also the innovation and partnerships that could build on this. Please go ahead.
Thank you, Mr. Mistry. It was a really enlightening talk. And though it's the last talk of the day, I was fully attentive. And you've delivered the talk very nicely. I have a feeling of excitement as well as apprehension in listening to the future of healthcare in India, because I know this is going to come, whether we like it or not. The excitement is that it's going to streamline the services, it's going to have discrepancies reduced, where in places where there are more number of specialists and in another place there are less, you will tie them up. I get that. My apprehension comes from your example of Make My Trip. It's if you interface an agency between the patient and the doctor, that can serve well, but isn't that opening an opportunity for the exploitation of the system so that it drives down the industry to cut corners in order to please the provider and not being patient-centric? It may move the care away from being patient-centric, and the family doctor is nowhere in the picture. That's my apprehension and my excitement also. I congratulate you on this presentation. So your thoughts on that?
So every new models, every new technology, everything new always brings the excitement and the apprehension, as you rightly mentioned. Same thing happened when during the COVID, the home care was there, telemedicine, remote health management, and very recently KPMG did a research and use cases of ChatGPT on the medical field in terms of diagnosis and how the patient could use it. It also provides an opportunity of, for us to reflect on that, how it can really be misused or how it can really help the patient. See, what happened is, what we are talking about is not something new. The care system exists in every country. Every country has experimented various forms of delivery, value chain, the stakeholders, partnerships, and so on. What we are talking about are some of the models that are prevalent across the globe. Now, it's a matter that if they are developed countries or they are developing countries or so on, the customization and the fitment that happens in a particular country depends upon the resources, the geography, the understanding, the awareness, the literacy, and so on. So what happened is the healthcare organizations like HMOs, health management organizations. So imagine today, if you have to find a diagnostic center, if you have to compare the value of a particular surgical procedures across the Pune hospitals, or to find a right doctor for you, how much effort you have to put in there? And do you really have a time for that? Okay, and still doing all of that, will you find the right kind of a guidance for you? Earlier times, you had a family physician with you. What was the thing? He was very much aware, well connected, and help you to navigate and make right decisions. And above all, you could trust them. Yeah? So you will find and you will see organizations whose objective is not to make a commission out of the referral, but to prevent you and get your right discounts. Imagine your wealth managements are there, correct? You have stock various in banks, you have wealth managers, a lot of other setting providers. You can reflect back on Israel's model of health management organization and various things. They will come to India in a different settings, which are fitting to the country and what is acceptable to the consumer here. But this is going to happen today or tomorrow. Today, we don't have time to navigate. Today, tell me there are 15 apps that you have for an online consultation. How do you choose which is the right one? There are 15 plus or maybe hundreds of diagnostic centers near your place. How are you going to decide what is right? What is their quality indicators? You have hundreds of doctors near you. How do you choose? And at the time of emergency, how are you going to choose that? And imagine if you are not around and your family members are there, how are you going to help them to reach and choose the right care for it? So it's going to happen, trust me on this, but it's a matter of time. It might not happen very immediately. It might not happen just pick and implement that in India. It will happen over a period of time. We have taken many overs. Your groceries get delivered at home, isn't it? Your entire travel get managed. A lot of other services is getting managed. It's a matter of time that will come. You trust, you will adopt, and you will implement it. So I'm very positive about it. It's a matter of time. Thanks.
I would now like to request Dr. Samita Jadhav, Director, Symbiosis Institute of Health Sciences, Symbiosis International University, to felicitate Mr. Lalit Mistry, sir. Thank you, ma'am. Thank you, sir.